would you prefer this view or would you rather my picture? It doesn't matter to me.
Either way is fine. You look fine. You look great.
I can see all this flyaways. It's nice. You're kind.
And Martine, while the mayor's speaking, I'm going to mute you. And then
Okay.
when it's your turn to speak, we'll unmute you.
Okay, that would be great. If y'all can split on that end,
Yes.
that's,
We will control that muting. So I'm going to test it right now. I'm going to mute you. Okay? You are muted. You can't do anything. And now I'm going to ask to unmute you. There you are.
okay.
Perfect.
So there was a question about being able to see the mayor live. Will I not be able to see him live on the Zoom?
You will not see him on Zoom. You will see him on Facebook Live.
Okay, so.
So you'll
okay.
be muted during that time.
Okay, well, I'm going to back up here to try to cut out reverberation, which I'm not. That's working better. Is that going to cause problems in y'all? Yeah. Does that make any difference?
Mayor, I'm going to try unplugging. I'm going to try muting me. Now try it.
No, it's still here.
You might be better with the handheld.
I think I'm going to be better just talking loud. I think folks can hear me. First of all, welcome. Sorry for the technical difficulties. As you can tell, we don't do daily COVID updates here from City Hall. I want to be respectful of your time and the time of the viewers that have joined us here today. Today specifically, we're here to talk about the public health crisis that we are still currently in Arkansas, in the country, and in the world. Recently, discussions have been unfolding about phases, and phase one and rolling into phase two now with an announcement today that as of July 1, we will have rolled into what are some early stages of the White House's guidelines under 3 by opening up the visitation of certain facilities such as long-term care, nursing homes, and state full-time care for disabled individuals. And so the narrative continues to be, as we open and as we phase open and as we come back together as a community, how do we do that safely? How do we do that in a way that does not cause the cases of COVID to spread more rapidly? Which, as we know, when they spread rapidly, they make it into the populations of our most vulnerable in society, which ultimately result in death in many cases. I can tell you that as of today, and you know, we've obviously seen a spike in cases in Benton County and in Washington County, in particular in Rogers and Springdale. And we're mindful of that, and we're concerned about that, and we're doing what government can do to play its positive role in flattening the curve, so to speak, with respect to the spread of COVID. And as such, today I'm happy to announce the rollout of a program called #KeepRogersSafe. #KeepRogersSafe is an initiative that is an opt-in initiative. It's a public health campaign that is centered out of the city government, out of my office. The program is designed, unlike many other government programs that have penalties associated, this is designed to be an opt-in good actor program that really just allows businesses to acknowledge that they are following both the public health directives, which they're mandated to do under their business licenses with the state, but it also shows their indication to adopt and to follow public health guidelines, which are not, as we know, mandated, i.e. the wearing of face masks in public places such as retail shops, grocery stores, gas stations, and those sorts of places where it's not a directive currently. And so the program works like this. It's online now. We are ready to take applicants. A business goes and fills out that application. They sign a pledge that is very simply stated that they will follow these public health guidelines in their business practices. We then will make that available to the public. We also will make it available to the businesses to advertise their elected membership into this campaign. This will in turn allow consumers a sense of knowing what businesses are concerned about their health and are concerned about monitoring and regulating social distancing guidelines and the wearing of face masks, because I believe most of you here today and anyone that's watching this has been in a situation where they're in a public setting, in a public place, wearing their mask, attempting to be cognizant of their space and socially distanced, and you got folks that'll just walk right up to you with no mask on, sneezing. And so, you know, we've got to do better than that in Arkansas, because as I've said before, this is not a political issue, it's not an art issue, it's not a D issue, it's an issue of respecting our neighbors, of helping take care of the people in our population that are most vulnerable. And I will tell you that as of today, I mean, just today in Rogers, we've run 2 COVID-19 related cardiac calls that did not end well. And so, and these individuals were not in long-term care facilities. They were not currently in hospital. They were you know, positive COVID patients. And so, and this is becoming a new norm. This is not an outlier. And I think it's also important to point out that we are in a new norm. We can't act like this is just a 1 month, 2 month, it'll be over by the summer type of deal. This is a new way of doing things. And the quicker that we are able to socialize this and make it acceptable and actually make it to where folks that don't comply are almost shamed, in my opinion, we won't get to move to the other phases. We will continue to see cases rise. We will continue to see death. We will continue to see the complicated way that our social structures can't reorganize, such as schools and sporting events and concerts. We have to take this seriously, and we have to make it widespread, because we know that the science shows if both of us wear a mask and try to stay socially distanced, but even if we can't, the percentage almost goes down into the single digits as to whether or not we pass this on along if we're asymptomatic and shedding the virus. So I'm passionate about this cause. It was an idea that I came up with last Thursday night and started war rooming it with some folks in the community that I trust. And obviously, you know, we were anticipating the rollout of the campaign, and then, you know, Fayetteville took their action yesterday, which kind of necessitated us maybe rolling this out a day or two earlier than we had anticipated. I would love to have a host of businesses here with me to show you who's opted into our program. You know, it's new, it's a test. I think it's the appropriate way for government to respond to this, where we don't have the authority to pass regulations that mandate businesses do certain things. And so we're just hoping that the business community recognizes that the vast majority of the consumers are looking for a place to shop safely. And that if I know, myself personally, if I know of a grocery store or a convenience store or any retail alike that is choosing to participate in this plan, and I can see it on the list, I can guarantee you I'm going there first. And so we're going to try to make it cool. We're going to try to make it a situation where it's a benefit to the business. If you look at the governor's directives on Monday, where he started talking about immunity as it relates to businesses and COVID, the language says substantially complying with public health directives. So, I would argue that if you opt into a program like this, you are by far more than substantially complying. You're putting a target on your face to say, we as a business are taking responsibility for the safety of our employees, the safety of our patrons, and the health of the community. And so I think, we're going to applaud the businesses that choose to do this. And I hope it's a success. I hope it helps keep a healthier community, make a healthier community. And I hope it helps us as it relates to the ability to start loosening up more things as we can trust the behaviors of people. Just this last weekend, I think everyone's seen the national story about, 10, 16-year-olds out in public at a birthday party. All of them contracted COVID. And when interviewed, they said, well, we went because the mayor and the governor said it was safe. They allowed these businesses to open, and so it must be safe. That's been my contention all along for folks that have had opinions, diverging opinions about opening certain facilities in the community, such as our aquatic center. To do that would tell the people of this community that it's safe to go there, and it's just simply not. Now, some folks may be safe, some folks won't get it. Likelihood is that you probably wouldn't. But is it worth the public risk when our behaviors have not changed enough to respect social distancing and understand the importance that it plays in helping us all keep a healthier community? So like all things good, and you don't hear this from politicians very often, but the government's not the end-all be-all to all things good, and the government's role in these things is in partnership with the community. And so today I'm pleased to have two guests, one virtually, one here in person, one representing the voice of business in Rogers, the other representing the voice of healthcare in our community. And so we're proud to have them here as partners in this campaign, as advocates of the campaign, and we hope that their presence and their advocacy underscores the importance of the compliance with social distancing and mask wearing in public. And so with that, I want to invite the President and CEO of the Rogers Lowell Area Chamber of Commerce, Raymond Burns, to come forward and make a few comments.
Mayor, thank you, and I appreciate the opportunity to speak today. Representing the business community of Rogers, Lowell, and much of Northwest Arkansas, we have over 2,100 businesses and about 5,000 individuals that belong to those businesses, and I believe each and every one of them want to do the right thing. And what we're talking about today is doing the right thing. We've gone from phase 1 to phase 2, and businesses are starting to open again, and for business, that's a good thing. But as we've said many times, phase 2 is really up to you. If people don't wear masks, if they don't distance, if they don't do the right things, and the number of cases keep going up, either people will not come to their businesses or we'll go back to another phase where all businesses aren't open again, and we certainly don't need that. Our role and our goal is to see that our economy opens again, and we can only do that through responsible action. And Mayor, I just want to tell you that I believe the business community supports you and what we're doing here today, and I really believe that the business community appreciates you and the City Council for not making this mandatory. We don't think there's a legal basis for doing that, and we think to do so would just be counterproductive. A voluntary effort allows people to opt into this. I'd say it was genius if I'd come up with it myself, and it is an election year, but with all that said, I think it's really important that people pay attention to what's being said here. We go to a business, we go to a public place, you've got to wear the mask, you've got to socially distance, and we can't put people down for wearing that mask. They're protecting themselves or their grandparents or their children. You don't know what everyone has to go back home to. And going back home and being safe is really what this is all about. So, Mayor, thank you.
Thank you, Raymond. Appreciate those comments. And at this time, we have virtually a guest representing Mercy Health, Martine Pollard-Downs.
You're on, Miss Martine Pollard.
Good afternoon.
Good afternoon, thank you.
Can you all hear me okay?
We can. Go ahead.
Great, thank you. Mayor Hines, thank you for the invitation to be with you today and virtually, and offering us the opportunity to express our support on behalf of Mercy Northwest Arkansas and our leadership team. We commend and support you and the City of Rogers in launching of your Keep Rogers Safe initiative. You know, Mercy, along with the other hospitals and healthcare providers in the region, have been working collaboratively since early March to ensure that we're caring, protecting, and educating our community on COVID-19. Our healthcare community recently launched, in partnership with the Northwest Arkansas Council, a Northwest Arkansas focused PSA campaign, Safe and Strong, and it really does capture the essence of the Keep Rogers Safe initiative. The key to all of this is being and staying vigilant, particularly as people return to their workspaces and more businesses begin to reopen. We have to stay vigilant, more so than ever, with our physical distancing, having good hygiene practices, and masking. We ask that everyone please wear a mask when they are venturing out and around other people. Until there is a vaccine to prevent COVID-19, the best way to prevent illness is to avoid being exposed to the virus. You know, our physician experts here locally and nationally can't reiterate this enough. Wearing a mask is one of the key ways we can prevent that. It prevents us from spreading the virus to others and preventing others from spreading the virus to you, along with the other practices that keep us safe. So again, Mercy supports and praises you, Mayor Hines, and the City of Rogers for their Keep Rogers Safe initiative, and we encourage our Rogers businesses to participate and pledge to enforce our public health guidelines. If we are all staying safe, we will all be able to stay open. So Mayor, thank you again for the opportunity for Mercy to be part of this important public health focused campaign.
Thank you, Martine. In closing, I think, we've refined the naming of the campaign. I'm just going to be blunt with you. My first version of it that late Thursday night was, and I think I called Ray and woke him up, was no shoes, no shirt, no mask, no service. And that's catchy. It's not good with millennials. I think the hashtag probably works better for them. But it's that simple, and it started making me think about no shoes, no shirt. And some of you in this room are too young to remember, nearly every business in our community had a sign up that said that when I was a kid. No shoes, no shirt, no service. Now, what was the point of that? Was it saving lives? Or was it to respect others' space and ability not to have to see you without a shirt on or shoes on? It didn't save a life. Yet businesses adopted it all over the nation and made it compliant. If we can do that, if we can shame people into putting a shirt and shoes on to go into a business that doesn't do anything to keep anybody safe, surely to goodness, we can shape our community in such a way that it's cool to wear masks, it's okay to wear masks, and it's acceptable, and in fact, it's unacceptable not to. It's disrespectful to your neighbors. So that's a parting thought, and with that, I'll conclude and would be happy to answer any questions if you were to have any.
Do you have any metric in place that you're going to use to judge as far as how successful you think this program is going to be?
So, you know, what we will do, it's an opt-in, they're going to sign up, they're going to be assigned to their category of business, and based on whether or not they fall under Arkansas Health guidelines or directives will dictate how we monitor them. It is our intention to do inspections, unannounced inspections, unscheduled and unannounced inspections. We will not be, and I think this is very important to understand, this is not a law enforcement related issue. There will not be police officers enforcing or testing the compliance of the membership in this campaign. I can't underscore that enough. I think we're at a point right now where we're tasking them with enough than to bring them into this narrative at this point. So we do plan to ensure that folks are complying. You know, one of the ideas was, well, what about what happens when someone, you know, sends in a picture on our report a concern tab on our city Facebook or website that says, you know, hey, I was here and there were, you know, customers without masks. What are you going to do about it? So, you know, right now what we would do with that is we would take that information as intelligence, and then we would ramp up the number of spot checks that are done at that location for a short period of time to look for compliance. Should we find non-compliance in the membership, they will be given a 24-hour corrective order, at which point they can be removed from the membership. So the beauty of it, it's an opt-in, it's an opt-out, and it's also a thank you for playing, but not so much. So, you know, that's the self-policing nature of the initiative. Yes, sir.
You guys say that enforcing face masks would be illegal. Springdale has said the same thing. What exactly makes an ordinance like that illegal?
So it's just there's no provision in state law that allows cities to mandate those types of activities in the public space or to private businesses. And so those orders are only and directives are only able to come down through the governor's office. And that's just the way that, you know, Arkansas cities exist at the pleasure of the Arkansas legislature. And so while cities aren't even mentioned in the Constitution of the state, we were created by the legislature, and they set our rules and our governing abilities, and that's just not one of the things that they have relegated down to the local level to be able to make a call. Yes, ma'am.
Do you have an idea so far how many businesses would like to opt in?
So I have no clue. I mean, like this went online live 2 hours ago, as far as I know. So, you know, we don't know that anybody knows about it. As I said before, my hope was to probably be doing this 48 hours from now when I could have a host of folks that had opted in that could give you comments about what it meant to them to opt in and what they think it's going to mean for their business model. So I suspect that anecdotal information will start to trickle in, and that might be some follow-up stories for y'all next week as you see the list grow and look at the types of businesses and number of businesses that are trying to be a part of the campaign. Any other questions? Okay. Well, thank you all very much for your time. I appreciate all of the networks being here. You know, it's an important message to get out to the public. So to your station managers, please pass along my appreciation that they allowed for you to be here today to cover this. All right.